25 days to complete the project from CT scan to ready-to-use titanium custom-made 3D printed implant. Is it fast or not? The main goal of this project was to design a patient-specific titanium implant for revision hip surgery, addressing a significant bone defect. The patient had a significant bone defect in the acetabular area, and the standard implants were not suitable due to the defect size. For the surgeon, it was not the first experience of performing the similar operations, but it was his first time of cooperating with our team. The main requirements for the implants were precise anatomical fit to the bone implants, stable and strong fixation, and also ability to accurate positioning the implant using navigation guides, compatibility with the standard hip components, and maximum convenience during surgery, including visual control and predictable handling. Everything starts from receiving the CT scan, and based on the images, we are creating a 3D model of patient anatomy, including the bone defect. It allows us to clearly visualize the problem and plan the further steps. In some especially complex cases, additionally to the CT scan, we could require some additional observations. For instance, bone density investigation, in order to understand the bone density in different zones. It will improve the outcome. Next comes preoperative planning, and we define anatomical landmarks or some center of rotation, angles of inclination and stuff. Then we create a preliminary model of the implant and define some fixation points. Then online meeting with the surgeon, clarifying some details or implementing some feedback and finalizing of the model. To achieve precise implant position, we use the system of navigation guides. This is just a prototype. They are colorful and attractive, and this is how the real guides look like. They are from nylon, and they are 5-7 times stronger compared to the photopolymeric resins, which usually could be also applied in this application, and they can be sterilized at normal conditions and stuff like that. But how does it work? First, we have the guide which based on the anatomical landmarks, and we install some pins based on it, and after that we use some reaming, some guides for reamer, like first one, the second one, and prepare the surface of the acetabular to install the titanium implant. After preparing the surfaces, the titanium implant could be installed. Basically, it fits perfectly to the reamered surfaces and fixed with the screws. Screw lengths we select according to the preoperational planning and the screw legend or screw map, depends how you call it. Additionally, screw lengths could be marked next to the holes in the implant, directly on the implant. It could be more convenient to the surgeon during the operation. This is as an option. The manufacturing of the implant took 25 days. This included all the stages, from receiving the CT scan, designing, adding some revisions and stuff like that, to basically manufacturing of the final implant from titanium. In this specific case, there were more revisions than usual, because the case is complex and also the surgeon wanted everything to be perfect. After all, the better the planning, the easier and faster the surgery, and the better clinical outcomes. That's why we carefully implemented all the surgeon requests and ideas. Even smallest improvements are important. The design and planning took around 20 days, and far more days took 3D printing and further steps of the manufacturing process. The surgeon was satisfied with the result, and he highly appreciated the quality of the work. He understands that in this case it was the first experience of our cooperation, and it took a little bit more time than usual, or than he expected. And he mentioned that actually he strongly recommended in our future cooperation. Basically, he would like to cooperate with us for the future, and the only thing he would like to improve is to shorten the time which further projects would take to develop 3D design from basically whole project from CT scan to manufacturing. He would like to shorten this time and receive the result faster. And what we learned during working on this case? The doctor was very demanding. It was actually very good, because attention to the details allows us to achieve the best clinical results. And why is it important? Because the better clinical result is, the better for us. We are interested in promoting the technology, and nothing could promote the technology better than good results, basically. So good results achieved with our technology is our advertising. And additionally, such high demands allows us to learn something new, and we believe in the concept of small improvements, basically, which means that if you improve for instance 5 different processes with a small, like 1% improvement, overall in total it will be more than 5% influence on the overall process results. Over the past 3 years of war, Ukraine has gained a unique experience in designing of patient-specific implants, especially for explosive injuries. Ukrainian bioengineers worked with very complex cases, and they had to develop basically some innovative solutions for the rehabilitation to deal with it. Also, very often foreign surgeons are coming to Ukraine to help injured soldiers and treat them and do some surgeries, and also they bring some high-quality experience to the country and share it, and share some solutions. Basically, they are sharing their experience, we are sharing our experience, and this collaboration or scientific cooperation, I would even say, could create some innovations and innovative products and solutions which could be very unique, not only for Ukraine, but also for the global medical community. And basically all this knowledge are accumulated in Ukraine right now, and as the world are ready to share with us, and we also are ready to share with the world. So basically we are ready to cooperate with the surgeons from other countries and share all this experience we already gained. Please subscribe to the channel and hit the like button if you find this case interesting. We will be sharing more clinical cases, and also you can write in the comment section that what would you like to see, what you would like to hear about, and maybe I was not right in some cases during my speech. So also please let me know that in the comment section. It would be very warm and active communication there, so don't be shy. See you next time.